Hey everybody, welcome to Options Rehab, Dr. Ruiz. And this is the third video that we make on our shoulder series, our shoulder rehab series. Right now I'm going to show you how to do a series of isometric contraction exercises for the shoulder girdle without doing any movement to irritate a shoulder that's acute or has a lot of problems. So Dr. Nick will come over here. All right, so the first thing we'll do is we get a soft ball. So you can use a ball like this. You can buy it on online, TheraBand, oops. And, or you can get one of those kiddie balls that they sell at the stores, at the dollar store they sell these. The idea is that it's got some give to it. So you want to be able to extend your shoulder completely. So holding the ball, get as far as comfortable from the wall that you can be. And then what we're going to do is we're literally going to have Dr. Nick here, so feet shoulder width, so you have a good stance. And you're going to go ahead and compress the ball, but you're not going to lean into it. You're literally just going to move the shoulder forward and back. So go ahead, give it a nice little push. Contract, hold it for like a second, and just relax. Good. So that is how you do one of them. Now we do these with him moving the shoulder in different directions. So the easy way to explain it is that we're going to go ahead and do the clock. So right now he's in what we call the 12 o'clock. We go ahead and have the patient rotate to 1 o'clock. Then we rotate to 2 o'clock, 3 o'clock, 4. Now we get into the areas depending on the patient's pain, but we can try and hit 5 and 6. Yeah. Okay. And then you start back up at 12. So these are, we call them wall pushes, and we have all our shoulder patients do these exercises here.
And again, the key is a slow, subtle, gentle contraction.
Right.
Little pain or discomfort is to be expected, but it shouldn't hurt.
And the movement you're doing is this right here. It's not this, but just the shoulder girdle. All right, that's one. The next one we're going to demonstrate is the, we call it a wall clock. So you're going to come up high. You want to get far away from the wall where you're kind of level with the ball, and you're going to go press. That's 12 o'clock. Press. That's 1 o'clock. Press. That's 2 o'clock. Press. 3 o'clock. 4, and so on. You want to come back to 6 and then roll the ball back up to 12 o'clock. So go ahead and give it a quick demonstration, Dr. Nick. So what I tell the patient is they want to know how far away from the wall. I say ball width, basically. So the width of the ball is how far your feet should be from the wall, more or less. And it's a nice, steady contraction of that shoulder while he's doing these.
And the key, what I notice is when the hands open or palm open, you just get a better shoulder contraction. You're not going to compensate from your forearm or other muscles that we're not trying to really work or rehab.
Not recruiting your biceps or your forearms, that's correct. And that's it. And then as far as repetitions, you want the patient to try to get, anywhere from 5 to 10 repetitions of each number. You'll feel a burn. Once you feel a burn, you know you're doing your exercise right. All right, and then the last one we'll demonstrate is the wall angels.
Okay.
Or, we'll do the wall angels. So the first thing is, you can go here and I'll demonstrate on you. So the key is to keep the elbows flat against the wall, the wrists as close as possible to the wall. So what you do is you curl back your fingers. And as you're doing this, you want to hear your fingers scraping on the wall. And you're literally going to bring your lats in like an angel. The key is to try to get rid of this lumbar lordosis he has here. So if he can flatten it out, good. And now you see his wrist come up. So you want to be able to get that as close as possible. And it takes a little bit of time. Demonstrate a couple repetitions for us, Doc. There you go. And even try to bring it in and you come up. So you get a full range of motion. Yep, and then what we do at the office here is we do an assisted version for patients that have a lot of shoulder problems.
And these are very end range movements, so that's why it's very
Right here at the
difficult.
very end is where it hurts, and it hurts everybody. There you go. And we do about 3 sets of 10 repetitions with these. Okay? That's it for the exercises up against the wall. We're going to do one more video that you can follow us on and watch, and it's going to be a series of plyometric exercises that we use here, which is a higher advanced version of treatment for the shoulder. Dr. Ruiz, Dr. Nick, Options Rehab, Nutley, New Jersey. Give us a like, give us a follow.